to hear about today. And I think everyone on the call knows me, but I'm Vanjie McCoy with the Dolores Early Childhood Council, and I am an It's About Kids member with the Children's Campaign. And I would like to introduce Katie Creedon, who is the coordinator for the It's About Kids Network. And she has a few words to say, and she'll introduce the main event, which is Sarah.
Yes, I am happy to be the lead up to the main event, as always. I mean it. So I'm Katie. As Vanjie said, I'm the network manager of the It's About Kids Network, which Vanjie is a member. And some of you I have met in the past few years when we've been lucky enough to be able to travel to Cortez and Montezuma County and see some of you in person, and hope to someday soon. But in the meantime, we are really happy to be able to do things like this virtually. And we're hopeful that the data that Sarah presents, and I'll introduce her in a second, will be something that you can take back to your communities. And we always want to hear how it resonates. And we will have question times available throughout the presentation. And then afterwards as well. So I'd like to introduce Sarah Hughes, who's our Vice President of Research Initiatives at the campaign. And Sarah has been working basically kind of without a lot of time in between on so many kids counts the past several years, as the data just kind of continues to be. She'll talk more about this, but as you all know, with COVID, data has been interesting at best to try to gather. And so I'm really impressed with what she and our research team have been able to put together. And hopefully this is helpful for you all. So I'm recording just so you know, and you can use the chat and I'll monitor that for questions as well. Okay, go ahead, Sarah. Thank you.
Thank you, Katie, for that very kind introduction, and Vanjie for having us here. I really wish that we were able to do this in person this year. I was looking back at last year's presentation, which was almost a year to the day ago. And I think I remember saying, like, hopefully next fall we'll be back on the road. So I won't say that this time in hopes that I won't jinx us, and maybe things really will get back to some semblance of normal. But just really excited that at least we can gather this way, and happy to be able to share some of the data from our 2021 Kids Count in Colorado report. And if you'll just give me one moment here, I'm going to share my screen so that you can see the slides that we're going to walk through today. Let's see. And can you just give me a quick thumbs up if you can see the Kids Count slides on the screen? Good, we're off to a solid start. You never know with Zoom whether this is going to pan out or not. But I'll take just a moment to talk a little bit about who the Children's Campaign is, if you're not familiar with the organization. We are a nonprofit, nonpartisan research, policy, and advocacy organization that works on improving child well-being for all 1.2 million kids across the state of Colorado. And we are based in Denver, but we have wonderful people like Vanjie in our It's About Kids network representing us in almost every county across the state, and helping us stay informed about what's happening at the local level. Because as you'll see today, we have a ton of data, but data are usually lagging behind where things are happening in real time. And so it's incredibly helpful for us to hear from people like Vanjie and from people like you about what's happening in your communities on the ground, so that we are staying up to date, especially right now when everything feels like it's changing every single day, and we're waking up every day in a completely different world from the one that was there before. So we're really grateful to that network for helping us know what to focus on. In our work, we really work across a few different issue areas. We work on family economic security, early childhood learning and development, child health, and K-12 education. And so we'll spend a little bit of time on each of those areas today as we walk through the data. And Kids Count is really sort of our foundational data product at the Children's Campaign. It's a report that we put out every single year, and it really aims to provide an overview of how kids and families are faring at the state level, and then also county to county. So we'll spend some time today going through some of the highlights from this year's report at the state level, and then also for Montezuma and Dolores counties. And just a couple things to say up front before we dive into the data. The pandemic changed everything. We all know that, and Kids Count was no exception. Normally, when we do Kids Count, there's always a lag in the data. So normally the 2021 Kids Count would have included mostly data from 2019. Now, however, when we think about 2019, all of that feels pretty irrelevant given the sort of earth-shattering effects that we've all experienced from March 2020 going forward. And so we knew we had to do things a little bit differently this year, because we know that the number one question people have is, what kind of impacts is the pandemic having on our kids and families? So we did our best to try to answer that question this year with the limited amount of data that are out there on 2020 and beyond. So this year's Kids Count does still include some of that 2019 data, pre-pandemic data from some of the traditional sources like the US Census Bureau, different surveys and data sources that state agencies are collecting. But then we also turn to sort of some new emerging sources of data that we haven't used in Kids Count before. A lot of these sources were actually created specifically for the pandemic time period to try to get that real-time information about what is happening for kids and families on the ground. And so some of those are the Census Bureau's Household Pulse Survey, the Healthy Moms Survey that's Colorado specific, did a survey that was focused on the COVID-19 time period. And so these are sort of new sources we haven't used in the past that we included in Kids Count this year to try to give a little bit of a picture of that pandemic time period. These sources are great, but I just wanted to preface up front that a lot of the time, these data sources don't have data available by county, because they did sort of get off the ground very quickly during the pandemic. A lot of the time they didn't have a big enough sample size to tell us what's happening at the local level. So just a heads up, as we move through the presentation today, you will definitely see data that's specific to Montezuma and Dolores counties. But just know that if you're seeing a lot of the pandemic data that's mostly state level, it's because these data sources just don't have that county level data available yet. We're working on our 2022 Kids Count report already, and we're hoping to be able to have a little bit more of that local level information. With all of that said, you all again are such a valuable source of information about what's going on during the pandemic. And so as we're moving through today, if we're talking about state level data and you want to talk a little bit about how you see these things playing out in Montezuma County or in Dolores County, please feel free to jump in at any point. It's so helpful for us to hear what the impacts have been on families across the state. So welcome you to do that at any time. I'm just going to check the chat to make sure we don't have any questions, but it looks like we can go ahead and get started with the real main event, the data, and we'll start with family economic security. And we're going to go back for a minute to sort of that pre-pandemic time period. What you see here is a graph showing the child poverty rate for Colorado, that's the green line, and the United States, the purple line, over sort of the 20 years leading up to the COVID-19 pandemic. And I want to point out a few things about this chart. Number one, you'll see that in 2019, Colorado's child poverty rate had fallen to 11%, which is the lowest level it had been at in 20 years, since back in 2000. So we were making a lot of progress here before the pandemic, and that's progress we want to protect in the years moving forward. The second thing I wanted to be sure to highlight is that when we're talking about poverty, we're talking only about an income of $26,000 a year for a family of 4. Now, I know the cost of living is very different depending on where you live in Colorado, but there's really no community across the state where $26,000 a year is sufficient to meet all of the basic needs for a family of 4. So it's important that when we're talking about these numbers, we recognize that that is a very conservative estimate of what it takes a family to get by on. And so the real number of families that are struggling to pay for childcare, pay for housing, pay for healthcare is going to be much higher than what you see here. But unfortunately, we don't have any control over how poverty is measured. That's all set by the federal government. So the last thing I wanted to point out here is a couple of time periods on the chart here. The first is the Great Recession. This was sort of the last big economic downturn that we faced as a state and as a country. And technically it lasted between 2007 and 2009. And you can see there that we saw our child poverty rate in Colorado increase a little bit, but then it kept climbing even after the recession was technically over, and it didn't hit its peak until 3 years after the recession ended in 2012, when 18% of kids across the state were living in poverty, almost 1 in 5. If we look at how long it took Colorado to get back down to where it was before the Great Recession hit, it actually took us 5 years after the end of the recession to reach that pre-recession level. And I bring this up because it's really important as we think about recovering from the most recent recession that we've been through that happened when the pandemic hit our state. We can't afford to wait 5 years for things to get back to where they were when COVID hit, because think about how long 5 years is in the life of a child. It's their entire early childhood experience when all of that brain development is happening. It's almost their whole elementary school experience when they're learning a ton of important skills. And so if we don't prioritize kids and families as we're sort of coming out of this recovery or coming out of this recession and thinking about what can we do to help them get back on their feet as soon as possible, we could be putting kids at a disadvantage for years to come in the future. So I think there's just important lessons for us to learn as a state when we look back to the last economic downturn that we all faced together. Now that 11% child poverty rate in 2019 can be kind of misleading for Colorado, because we know that conditions vary a ton for kids based on where they live in our state. So this is a map that breaks down that child poverty rate by county, again in 2019, which is the most recent data that we have available right now. The darker colored places are places where the child poverty rate is higher. The lighter colored places are places where it's lower. And you can see that again, even though the statewide child poverty rate was 11%, we had some communities in the southern and southeastern portions of the state where the poverty rate for kids was more than triple that statewide average, where more than a third of kids were living in poverty. If we look at Montezuma and Dolores counties, we can see that in Montezuma County, about 25% of kids were living in poverty before the pandemic hit. And Dolores County a little bit lower at 15%, but still both above that statewide average. And was someone trying to jump in with a question there? No? Okay, I just didn't want to cut you off if you were trying to add something. We can also take a look at, if my slides will move here, there we go, the trend in Montezuma County and Dolores County leading up to the pandemic. In Montezuma County, even before the pandemic hit, the child poverty rate had yet to return to where it was back before that last recession, the Great Recession, between 2007 and 2009. Although we saw the state sort of come down and recover to where it was before the recession hit, we didn't see that same trend happening in Montezuma County. And you can see that Dolores County had just sort of gotten back to where it was before the Great Recession as of 2019. And then of course, COVID hit our state in early 2020 and everything changed. We don't have good child poverty data for 2020, and we may never have it because of disruptions to data collection caused by the pandemic. But we can look at some other indicators to help us figure out how families were doing economically. And those other indicators point to widespread economic struggles for families during the pandemic. One of the indicators that we look at is the unemployment rate, because the child poverty rate tends to track that pretty closely, which makes sense because as parents are out of work, their incomes are going to be lower and they're going to fall below that child poverty level in many instances. And the trend here was not good in 2020. You can see back in January of 2020, before COVID really hit Colorado, we had record low unemployment rates. But as soon as COVID hit and those stay-at-home orders were issued, we saw the unemployment rate more than triple. here in Colorado, and by April, 12%. So more than 1 in 10 Coloradans were out of work. And then even though that unemployment rate started to go back down a little once restrictions lifted and things opened back up a little bit towards the end of last summer, you can see that even as of December, that unemployment rate for Colorado was still much higher than it was back at the beginning of the year. So again, even though we're seeing some improvement in those economic indicators, we know that kids and families necessarily feeling all of that improvement and are still likely to be struggling. We can also take a look at similar data for Montezuma County. Montezuma County started off with a higher unemployment rate than the statewide average. So it didn't see quite as big of a jump as the state saw, but it's still, the unemployment rate doubled between January and April of 2020. And again, it remained higher at the end of the year than it was at the beginning of the year. And Montezuma County sort of started off with that already high child poverty rate of 25%. So we know, again, kids and families really feeling the effects of the economic downturn here. In Dolores County, a little bit of a different trend. Again, we see that big peak in unemployment in April, and then things sort of going back down throughout the summer. But in Dolores County, that unemployment rate started to even inch back up again toward the end of the year. Now, these are data that we can't get at the county level, but I think they're really important because even though they're statewide data, they probably do capture the experiences of many kids and families in your communities and in communities across the state. So these data come from the Household Pulse Survey that the Census Bureau does that started being administered pretty soon after the pandemic hit Colorado in 2020. And it breaks down data for Colorado households with children. And among those households with children, about half of all of them across the state have reported a loss of household income since the pandemic began. Half, that's a really staggering number. About 1/3 have reported difficulty paying for usual household expenses, including food or medical care. And then finally, as many as 1 in 5 households with kids in our state have reported that they had little to no confidence in their ability to pay their next rent or mortgage payment. Housing especially is an area that we know Colorado has struggled with for many years. Even before the pandemic hit, it was very difficult to find affordable housing for families in many communities. And we know that as so many people were losing income, that housing struggle got even more severe in a lot of places. And so moving out of the pandemic, as we hopefully move out of the pandemic, again, I don't want to jinx us. We need to be thinking about how we're going to make sure that families and kids can keep a roof over their heads, given how important housing is to child well-being. We can also take a look at some of the data by race and ethnicity. Our state and our country have always had racial inequities in a lot of areas of child well-being because of a long history of policies that have disadvantaged people of color and advantaged white people. And unfortunately, when the pandemic hit, it sort of exacerbated those disparities even further. And so if we look across almost all indicators that we look at during the pandemic, we're going to see households with children of color being hit harder than households with white children. And so just a few examples from earlier this year in 2021, if we look at households with kids in Colorado that have lost employment income, it's high across all races and ethnicities where we have data, but it's particularly high for Hispanic or Latino households in Colorado, where 2/3 of those households with kids reported losing employment income. Again, we see a similar pattern among households with kids that reported difficulty paying for usual expenses. Almost half of Hispanic or Latino households with kids and households of 2 or more races reported having trouble making ends meet there. And then a similar pattern for housing, where our Hispanic and Latino households with kids in our state reporting difficulty paying their rent or their mortgage payment on time was almost triple the percentage for white households. And these data are really important because it shows us sort of, we need to be focusing on helping all families with kids, of course, on coming out of the pandemic and the economic downturn, but we really need to make sure that we're supporting our kids kids and families of color who even before COVID hit were facing more barriers to economic opportunity than their white peers. So any questions so far on any of the family economic security data or anything that you want to add from what you've experienced? And you
I
can,
have a question for you, Sarah.
sure.
With Montezuma County, you know that map that you showed, and
Mhm.
it had the different colored on the different counties. And I noticed that some counties that were a kind of small rural counties had a better, let me see, I'm glad you're going back. Like say, for instance, Albert.
Mhm.
Albert is considered a small, medium-sized county, kind of the same numbers that we have. I'm just throwing that out. Is there further analytics being done as to why they're shown regarding maybe being lower, and ours is showing higher? And what is that county doing differently than our county? What are the differences?
That's a really great question. And I don't know the answer off the top of my head, but I'm sure if we dug into different statistics like the unemployment rate or like what the median wages are in that county, we might be able to see if there is a difference because it ultimately all comes down to economic opportunity and the wages paid in a community and what's available for people in terms of jobs and employment. So
I'm just very curious because I've been in Albert County. I've stepped foot in Albert County, and you would think it would be a lot higher than Montezuma County. So I'm just wondering what kinds of things are they, what's, like you said, what are the differences? And maybe we can learn from that county, whatever great impacts that they're doing in terms of economic security.
Yeah, that's an excellent point, and exactly sort of the way we hope people will use these data. I think every county is doing something really well, and every county has something that they could learn from another place. And so if there's ever like a connection that we could make through our IAK network or something like that, we would be happy to do that. Or I'm happy to dig into the data and see. With Elbert County, it may be a couple of things. It may be like the proximity to the Denver metro area. If people are commuting into Denver and working at jobs that pay a higher wage, for example, that could make the child poverty rate lower for Elbert County. It also could be just sort of how we see the state level average doesn't give us the full picture when we look at from county to county. It could be that in Elbert County, there are pockets of really high child poverty and then other parts of the county where it's lower. So that could be the case too. But I think you're bringing up a really good point that is like, what can we be learning from other places that we might want to implement here? So thank you for that.
Well, thank you, Sarah, because I was thinking the same thing. They're looking at jobs elsewhere and they'll transport themselves in and out of Albert County, which makes sense to me. But that would be a big hike for some of those families to transport to and from work. And that's another burden, not in terms just for their family, for their children, not being able to spend enough time with their children.
Yes, absolutely. And that's, income security, financial security is important, but it's not everything. You bring up a really good point that sometimes in order to find a higher paying job, families are having to make sacrifices in other areas in terms of time spent with their kids or the struggles that it could be to have your child in childcare in one community and be working in another community. So those are all great points.
Are you going to share these slides with us?
Yes, I should have said that at the beginning.
Okay, thank you.
Yes, I'll send these to Vanjie as a PDF and she can send them out afterwards. And then we'll also share the recording afterwards too. So we'll be sure to do that.
Thank you.
You're welcome. Any other questions or thoughts on the economic piece? All right, well, if any come up as we're moving through, please feel free to put them in the chat or jump in at any point. But for now, we'll move on to the health section. And obviously, first and foremost, COVID-19 was or is something that affects our physical health, but you might have heard people talk about the second pandemic or the twin pandemic of mental health struggles during the pandemic, because we know that when you have social isolation, when people are missing their normal routines of school or working outside the house or whatever it is, when you have economic hardship, all of those things are sort of this perfect cocktail of ingredients to either cause new mental health struggles or exacerbate existing ones. And so we talk a lot in Kids Count this year about mental health of caregivers, and when available, data on kids' mental health as well. So I wanted to spend some time talking a little bit about that. Data on the mental health of kids and youth specifically during the pandemic have still been pretty limited, but data on the mental health of adults who live with kids in Colorado show that symptoms of anxiety and depression were really widespread during the first year of the COVID-19 pandemic. So this graph that you see here is a graph showing the percent of Colorado adults who live in households with kids who reported symptoms of either anxiety, that's the top line that you see there, or depression for more than half the days or nearly every day in the past week. And you can see that throughout the first year, these numbers were very high. They peaked in the wintertime of 2020 and sort of early 2021, when 41% of Colorado adults in households with kids reported feeling nervous, anxious, or on edge most of the time. And 24% reported feeling down, depressed, or hopeless. So I think these data, the immense toll that the pandemic and the isolation away from people has caused on families and on parents and on people caring for kids. And although these data reflect adults' experiences, we know that the mental health of kids is obviously really closely linked to the mental health of their caregivers. And that was probably even more true during the past 2 years or so, when so many families were spending 24 hours a day under the same roof without those typical outlets of work or school or social activities. And so if we're seeing these widespread struggles among adults who live with kids, we would likely be seeing similar struggles among kids themselves. And in fact, even though we don't have great hard data on this for Colorado yet, many people have probably heard from places like Children's Hospital Colorado or the American Academy of Pediatrics that kids' mental health right now is really an emergency in terms of the number of kids that they're seeing showing up with really significant mental health struggles. And so, and this is something that's not just going to go away, right? When we hopefully finally make it out of this pandemic, this is something where we could be seeing really long-term impacts for kids and their families. And so we have to think about in our communities, how are we going to make that mental health care and that treatment accessible for people who need it? Because we know that the need is there and it's not going away anytime soon. We also have been tracking for a while the teen suicide rate in Colorado. And even before the pandemic hit our state, the teen suicide rate for kids ages 15 to 19 had already reached historically high levels. And although it didn't spike in 2020, as some people may have been expecting, it did remain extremely high, with 83 teens across the state losing their lives to suicide in 2020, which you can see is more than double the number who died by suicide just 10 years earlier in 2010. We can look a little bit at Montezuma County. We have to look at sort of a 5-year period here in order to get enough data. But if we look at the 5-year period between 2016 and 2020, we see that Montezuma County saw 4 suicides among teens ages 15 to 19 and 3 among 10 to 14-year-olds. So even among very young children. And again, this is sort of just at the beginning of that pandemic, and in some cases for Montezuma County in the years prior. And so we know that this is something that we really have to be vigilant about as we continue down this really tough path. One group that may have been particularly at risk heading into the pandemic is pregnant and postpartum Coloradans, because mental health struggles were already pretty common among these groups even before COVID-19 hit. So these are all pre-pandemic data that you're seeing here. And even before the pandemic, we saw 12% of postpartum people in Colorado reporting postpartum depressive symptoms. By a year postpartum, nearly 1 in 3 had elevated symptoms of anxiety. And among those who wanted or needed mental health care or counseling when they were postpartum, fewer than 2/3 were able to access it. So even though these issues are very common, we know that many postpartum people in Colorado struggled even before COVID to get the care or counseling that they needed. And then the pandemic hit, and it only intensified a lot of the existing risk factors for postpartum depression and anxiety. Having a new baby is a huge transition, no matter when it happens. It's hard enough already, but then even in normal times, but then when you add on, again, the social isolation, not being able to get in-person help or support from friends in many cases before vaccines were available, not even being able to access in-person postpartum care or lactation support. All of those additional stressors are going to be intensified or were intensified during the pandemic, putting people at even higher risk of postpartum depression and anxiety. And so this is where we looked at the Healthy Moms survey specific to the COVID-19 time period. And this survey found that half of all Colorado parents who gave birth between March 2020 and February 2021 reported that their mental health had gotten worse since the pandemic started. And about 40% of those who gave birth during the first year of the pandemic reported that they needed or wanted mental health care since having their baby. Of those, only half were able to get it. So before the pandemic, about 2/3 were able to get the care that they needed. In the first year of the pandemic, only half were able to get it. And the survey actually collects data on the barriers to getting that care as well. And you can see here that concerns about the cost were sort of first and foremost. And then the second concern was that they didn't have someone to watch their children while they accessed that care, which makes total sense that this would be such a common barrier during that first year of the pandemic, when many schools were remote and kids were at home, when many childcare settings were closed. And so that childcare barrier became a really big one for a lot of these new moms who were struggling with their mental health and wanted to be able to access that mental health care. And this is so important because we know that those early childhood years, those first few years, are so critical when it comes to healthy brain development. And so we need to be making sure that we are making sure that moms and dads are well supported in those early years so that they can provide the kind of support and encouragement that they want to provide for their little kiddos. So again, a really important group to prioritize getting mental health support to as the pandemic sort of continues on. Going back sort of pre-pandemic here to look at a couple of things. I think this is a good example of why those pre-pandemic data are still really important, because they can show us sort of where we were already struggling and what might have gotten even worse since the pandemic started. So I wanted to highlight some of the data on maternal and infant health in Dolores and Montezuma counties in 2019, so before COVID had become a reality for our state. We can see that even before COVID hit, access to early prenatal care in Montezuma County and Dolores County was really limited for a lot of families. So in 2019, fewer than half of all babies born in Dolores County were born to women who had early prenatal care or care that started in the first trimester, compared to 82% statewide. We also saw much higher rates of babies born to moms who smoked during pregnancy in Dolores and Montezuma County, with almost 1 in 5 babies born in Dolores County in 2019 being born to a mom who reported smoking while pregnant. Low birth weight births is an area where Montezuma County was doing better than the statewide average in 2019. But Dolores County, you can see there the rate of low birth weight births was quadruple what we saw at the state level. And we know that being born at a low birth weight can cause a lot of health problems for babies. So that's an important one to sort of focus on. And it'll be interesting again to see how these change once we have data from the pandemic time period, because we know that in a lot of places, barriers to prenatal care got even harder to overcome. And a lot of other factors that affect the health of moms and babies were sort of worsened as well. So it'll be interesting to keep an eye on this as we get data for 2020 and beyond. Another area that I wanted to highlight sort of what was happening going into the pandemic is health insurance. Colorado had been a really huge success story when it came to health insurance for many of the last several years. You can see that back in 2008, we had almost 180,000 kids across the state who did not have health insurance. 8 years later, in 2016, that number had dropped by about 120,000 kids, with only 57,000 kids remaining uninsured. And this was due to some policy changes at the state level, things like expanding Medicaid and the Child Health Plan Plus, as well as many of the provisions of the Affordable Care Act going into effect in 2013. But all of those things sort of worked together and helped us make really incredible progress on kids' health insurance coverage. Unfortunately, though, we've started to see this progress sort of stall in Colorado and then even reverse in recent years. You can see that green line that represents Colorado's uninsured rate for kids is sort of creeping upwards since 2016. And so we actually went into the pandemic with 73,000 kids across our state lacking health insurance coverage during the worst public health crisis our country has experienced in at least a century. And so we know this is an area where we might see kids losing coverage if their parents lost their jobs and lost their health insurance through their jobs. And so it's going to be really important for us to not see this progress that we've made over the last decade or so get erased as a result of COVID. Here we can look at data from Montezuma and Dolores counties, and you can see a similar pattern with both counties making really incredible progress between 2008 and 2016. The uninsured rate falling by almost 2/3 in both places. But again, as we look at sort of the last few years between 2016 and 2019, we see that progress sort of stalling with 9% of kids in Montezuma County still uninsured, 8% in Dolores County. Questions on any of the health data or anything that you want to add here? All right, well, we will move on to early childhood. And again, feel free to put any questions that come up in the chat. But early childhood, again, we'll talk a little bit about some of the struggles that Colorado was seeing before the pandemic and then how things have changed since COVID hit. But we know that even prior to the pandemic, access to childcare capacity was a really significant challenge for almost every community across the state. I've never really met or been to a community where people are like, oh, we're fine on childcare. We totally have enough affordable care for people. We know this was a huge problem for families and for providers who wanted to provide care even before the pandemic hit the childcare sector really hard. So this is again 2019 data. If we look at the number of kids in our state under 6 who had all parents in the labor force, so kids who most likely needed care at some point during the day while their parents were working, there were about 246,000 kids who fell into this category. Now, if we look at licensed capacity in Colorado's childcare centers, family childcare homes, and preschools, we see that there are only enough slots in those settings to serve 62% of the kids who probably needed care, which left 94,000 kids who most likely needed care but weren't able to access licensed care in their community. And I should say here that we're only focusing on licensed care here because that's what we're able to get data on. It's a lot more difficult to get data on the number of slots in family, friend, and neighbor care settings. So we know that some of these children may be cared for by a family, friend, or a neighbor, but we also know just from talking to families that even if we were able to factor that care into these numbers, there's just not enough care out there. And again, this was a challenge before COVID. COVID hit, and from talking to childcare providers, looking for childcare for my own child, and looking at the numbers, we know that COVID really did a number on the childcare workforce, the childcare providers, and parents and families. You might have seen research from one of our partner organizations at Early Milestones Colorado. They looked at sort of childcare capacity during the first summer of COVID, so during 2020, and they found that during that time, nearly 1 in 10 Colorado childcare providers closed during the early months of the pandemic, and total enrollment dropped by more than half. They also surveyed families and found that 2/3 of Colorado families that they surveyed reported having to alter arrangements due to the pandemic, and about 1/3 reported not having the care that they needed in the summer of 2020. Now, losing childcare, of course, has implications for parents' employment and for families' financial security, but it also, research shows, affects their mental health and the mental health of their children. There was some really interesting national research that came out during the pandemic that showed that parents who lost their childcare during COVID reported much higher levels of stress and anxiety than those whose childcare situations had not changed. And then those who lost their childcare also found that, or also reported that their kids were significantly more fearful or fussy than kids whose childcare settings hadn't changed, which makes sense. It's a big disruption for a little kiddo in their daily lives. And so clearly a lot of implications for childcare providers and for families. And even now, 20 months into the pandemic, we're still hearing how tough it is for providers and for people with young children. And I think in our more hopeful moments, we sort of hope that if nothing else, the pandemic is making everybody realize just how critical childcare is to the economy. I think a lot of people are talking about a workforce shortage across all these different industries and not being able to find people to come and fill jobs. And so much of that is due to the fact that people don't have reliable childcare right now. And so if we can see more employers, more policymakers really recognizing the value that childcare providers provide, not just to kids, but to our society as a whole and to our economy as a whole, maybe we can sort of get some much needed support for this industry and for the people who are working in this industry as hopefully one silver lining coming out of the COVID pandemic. We also know that childcare was not the only early childhood program that really took a hit during the early days of the pandemic. We also wanted to look at how programs like early intervention were faring. I know we probably have a lot of early childhood people on the call, so I won't spend too much time talking about what early intervention is, but essentially it's a program that serves kids ages birth to 3 who have a delay in at least one area of their development, and it provides them services to help them catch up and get back on track. And referrals, families can refer their own child to early intervention for an evaluation, but most of the referrals are coming from pediatricians' visits or childcare providers. These are people that kids weren't seeing very often in those early days of the pandemic. And so it would make sense if we were seeing fewer referrals to this program during the pandemic time period. And in fact, that's exactly what we saw. So these are data that show weekly referrals to early intervention in Colorado in 2019. That's the gray line that you see here. In 2020, that's the sort of teal colored line. And you can see that up until March, the 2020 line was pretty closely tracking what we saw in 2019. Then in early March, of course, the pandemic hits and we see those referrals plummet. They fell by more than 50% across the state of Colorado, with 416 referrals happening the week of March 1st, 2020, Within 2 weeks, that number had fallen to only 155 referrals, and those referrals to early intervention stayed much lower than their 2019 levels for almost the rest of 2020. And this is really troubling data because we know, again, how important those early years are and how you don't get a second chance at those early years. And so this drop in referrals most likely reflects kids who really needed these supportive services and were not able to access them in a timely manner. And in fact, if you look at the number of kids who actually did enroll in early intervention, that number was 20% lower in January of 2021 than it was in March of 2020. So far fewer kids and families receiving these services as a result of the COVID-19 pandemic. And then finally, we also saw fewer kids statewide enrolled in preschool programs in the fall of 2020 as the pandemic sort of raged on. We only have data on school district preschools because that's what we're able to get from the Colorado Department of Education, but they reported overall 23% fewer preschoolers enrolled in the fall of 2020 compared to the fall of 2019. And you can see that for some racial and ethnic groups, American Indian or Alaska Native children and Asian children in particular, that drop was even more significant. And then we can also take a look at this for Montezuma County schools. School district preschools in Montezuma County saw a slightly larger increase than the state saw, and then very large, or slightly larger decrease, excuse me, than the state saw, and then very large decreases among the American Indian or Alaska Native population, where the enrollment fell by almost half, and among Hispanic or Latino children as well, where enrollment fell by almost 40%. And this is really critical because we know that presumably all of these children are going to enroll in school at some point. Some of them may have been able to have really enriching, great learning experiences at home during that pandemic year. Others, though, we know are going to be coming to school, starting kindergarten, struggling with the skills that they need because they didn't have a chance to learn how to sit in a classroom or work with other children or listen to instructions from a teacher. And so we're going to have to be thinking a lot about how do we meet kids and families where they are when they're starting in the school system, recognizing that they didn't get to have one of these really important experiences in terms of preschool access during their early years. Questions or thoughts on the early childhood data that you want to share? I guess, oh, sorry, go ahead.
Yeah, I just wanted to say that, like on the reservations, that the childcare went to all remote, and so it wasn't necessarily helping parents with taking care of the children so that they can go to work.
Mhm.
And I don't know, I'm just throwing that piece out. That's not true with all childcare across Montezuma County, but I know that on the reservation, that's kind of what it looked like. And so I'm thinking that that probably was a deterrent to people really enrolling and
Yeah,
being a part of that. So
that makes a lot of sense. It's sort of, it's nice that that resource is available, but it also takes time and dedication from the parents to supervise that remote instruction. And if you don't have that time and you're working, it's going to be very difficult to enroll your kiddos in those services. Thank you for sharing that context. That's super helpful. Any other thoughts or questions on this section? All right, well, the next section we'll cover, and the last section actually, is K through 12 education. And we talked a little bit about the decline in preschool enrollment across Colorado and in Montezuma County. And we did see the biggest declines in enrollment in those preschool and kindergarten years in 2020. But overall, we saw student enrollment for all grades, pre-K through 12, fall for the first time since 1988 in Colorado, with about a 3% decrease in the number of kids who were enrolling. It's difficult to say where these kids went. We don't know, did they leave the public school system for a private school system? Did their parents just decide to wait a year before sending them back? It's hard to know what their educational experiences might have been during that school year, but we do know that we saw far fewer kids enrolled in our public schools in the state than we have seen in recent years. And then looking at Montezuma County, you see a similar trend. There had been some recent decreases in enrollment in Montezuma County public schools even before the pandemic hit, but you can see between 2019 and 2020, there was a really sharp decline there with about 6% fewer kids enrolling in 2020 than in fall of 2019. And Dolores County, the trend was a little bit different. We've been sort of seeing a steady decrease in enrollment in Dolores County public schools over the last decade or so. And their enrollment actually stayed pretty flat between 2019 and 2020. So a little bit of a different trend than we see in the state as a whole or in its neighbor in Montezuma County. Of course, we can't talk about education during the pandemic without talking about remote learning, the bane of many parents' existence, I'm sure. We know that when the pandemic first hit, that in an effort to keep kids and families safe, schools shut down pretty quickly and went to remote learning in most communities across the state. And if we look at all Colorado households with kids, we see that as of the end of the 2019-2020 school year, almost 80% reported that they had their classes moved to distance learning using online resources. 15% were using paper material sent home, and then almost a third reported that they had some classes canceled of the pandemic. So really, no matter what the change was, it was huge disruption to the way kids were receiving their education and to the way parents and caregivers were supporting their kids' education. And we know that for some kids, there were more barriers to remote learning than there were for others. Many kids across the state went into the pandemic without having reliable internet access, or maybe not even having a device that can access the internet at home. And to put some numbers to this, the Colorado State University did a study and found that there were, going into the pandemic, there were 54,000 school-age children in Colorado who did not have internet access and therefore would not be able to access those remote learning resources. And that these children without internet access, excuse me, were disproportionately Hispanic or Latino in the early elementary grades, and had parents who were essential workers. And of course, if your parent is an essential worker, that's sort of even an added barrier, an extra barrier to being able to do remote learning when you don't have a parent who's able to be there, excuse me, and supervise that learning. So we know that even though schools were still working really hard to provide remote learning opportunities during the pandemic, there were tens of thousands of kids who probably fell behind because they weren't able to access that service due to a lack of internet. So that's sort of all the data and information that we have for you today, but just wanted to leave you with a couple of things. I think one of our biggest messages as we're sort of out talking to policymakers and people who have the power to make some pretty big decisions about our state is that while some of these conditions might be temporary that kids experienced during the pandemic, whether it's remote learning was temporary or their parents lost their job for a few months and that was temporary, we know that our kids are going to need support with the fallout from the last 20 months for years to come. So even if we get back to a point where COVID is manageable, it's not causing these widespread disruptions anymore, we know that kids have been living with disruption for so long now that they are going to need support to recover from everything that has upended their lives in the last almost 2 years. And so we sort of for the first time in Kids Count this year included some specific policy recommendations that we'd like to see Colorado adopt to prioritize kids and families in the months and years ahead. And I won't spend time walking through all of those, but they are included in the report. There's a link to the report at the end of these slides, and it's available on our website. And you can jump right to those pages that you see listed here to look at what we are recommending in the areas of family economic security, child health, early childhood, and K through 12 education as ways to help kids moving forward. And then one of the biggest messages I think I found myself thinking a lot like, oh, I can't wait for things to get back to normal. But as we looked at that pre-pandemic data, we could see that normal still had a lot of challenges. We still had 70,000 kids without health insurance in normal times. We still had 11% of our kids living in poverty in normal times. So when we're thinking about, excuse me, it's an ill-timed tickle in my throat right now. As we're thinking about coming out of the pandemic, we can't just shoot for getting back to normal. We really hopefully can use this as an opportunity to show how we can better support kids and families, even when there isn't a pandemic going on. And we welcome your support and your partnership in figuring out ways to do that. So with that, I'll just go ahead and wrap things up. I'll leave you with some links here to the report or to our website, and I'm happy to take any questions or thoughts that you might have.
I think everyone's just overwhelmed.
Yeah, yes, it is. It's very, our day-to-day lives are very overwhelming. Everyone's right now. And then you layer on sort of all of this information about the struggles that our state has been having, and it is super overwhelming. Absolutely.
Because I don't see anything in the chat, question-wise.
Yeah, and I guess just an invitation as well. We are, as I mentioned, working on our 2022 report soon, and I'd love to hear from you all either today, or you can email me. My email address is up here. What do you want to know about the pandemic and its impact on kids? Because we're sort of in a whole new world data-wise, where we have to look to different places and focus on different topics. And so if there's something where you're like, I've really been hearing a lot about this in my community, I'd love to see data on that topic in next year's report, please let us know, because that's sort of how we get the best suggestions and ideas for what to focus on in terms of data. So we'd love to hear that anytime.
Sarah, this is Gina. I just was wondering, do you have specific data in regards to high school students' substance usage?
Good question.
And I'll tell you why I'm asking you this.
Sure, go ahead.
Because juvenile probation, their caseloads have increased probably by 50%. So I would just think that's a population that sometimes we somehow miss regarding data. And so I'm wondering who would be a good contact person to get that kind of data?
That's a good question. We have a little bit of those data, but there's always like a time lag with them. Where we usually get substance abuse data for the high school population is from the Healthy Kids Colorado survey, where they asked about drug use or alcohol use. But those data, most recent that are available, are only from 2019. And so it doesn't really capture that pandemic time period.
Yeah, I think it's gone up higher now with the drug usage and for high school students. And I'm really concerned with that population and what's going on and the types of drugs that they're using now. It's very concerning.
Thank you for highlighting that. And that's definitely something that we can look into more, because I would imagine maybe like the state's behavioral health people might have some information on that, or maybe even Children's Hospital with high school kids showing up at hospitals around the state with substance use problems. But I think you're right that it probably has, I know I've seen statistics on substance use among adults has increased significantly during the pandemic, and that drug overdoses and deaths by drug overdose has really skyrocketed since COVID hit. And so I wouldn't be surprised if we were seeing a similar trend in the youth population. But I can definitely make a note of that and see if there's a better, more timely source out there for those data.
And I think Bobby Locke mentioned something in the chat about why it's important to continue the Healthy Kids Colorado survey in our schools. And I'm on board with that. I think it's much needed for all our schools to participate. So I'm with you, Bobby, on that. I hope you can hear me.
I can hear you, Gina. Yeah, I think, and I know that a lot of folks, you folks were contacted already by Arlena and a few others in regards to what our districts are looking at doing with that Healthy Kids Colorado survey. And honestly, historically, kids are very honest in that survey, and they will say if they have or have not tried, used, whatever, and that is valuable information. So I'm hopeful that our districts will reconsider what they're considering. So
Let's just hope that's all we can do at this point. I don't know, but I'm willing to write a letter of support, Bobby. So let me know.
Yes, that's an excellent point. The Healthy Kids Colorado survey, I know every time it comes out, it generates some controversy around the state, but I mean, just from our perspective, I can't state enough how valuable it is because it's one of the only surveys that collects data on that age group. And without that information, we lack data on substance abuse, we lack data on mental health struggles. It really just becomes this black box where we know what we're hearing, but we don't know how widespread the problems really are. So I'm glad to hear that there are folks that are supportive of that survey because it really is so important.
you can see in the chat that Arlena has put her email. There's work being done so that we can have a presentation to the school board in January. So please reach out to her if you are interested in participating in that.
That's good because there's a juvenile probation officer who just came on board. And I think he would be a good person to contact. I'm gonna get him in touch with you, Bobby, or Arlena. I have one more question, Sarah. You talked about the number of births, you know, is there data on the number of single parents? You know, sometimes that is very stressful when you don't have two parents and you have a single parent giving birth and what supports and resources that person. Does that also come in on the data?
It does. We have that in a couple of different, or we can look at that in a couple of different ways. So we have data from the public health department on the percent of births to single moms. So we have it specifically for babies. And then we can also look at census data on just overall the percent of kids living in single parent families, kids of all ages. One good place to look for at least one of those actually is in the Kids Count report. There are data pages at the back that have data specifically for Montezuma County and for Dolores County. I know the births to single women stat is in there. And then I can always get you the data on the percent of kids in single families as a whole.
Okay, and my last question for you, and I'll shut up after this.
No, we've
Yes.
got plenty of time.
In terms of behavioral health and the funding that's coming forward and all these grants that come to us, and people are collecting data left and right, and they're always asking me for data on our numbers for economic security, SNAP, Medicaid, TANF, et cetera. And I'm throwing out data left and right. Could we, whoever's writing these grants, because we have a grant writer now for the county, if something comes on board again, because they just submitted a grant for a community intervention program, and that's where all this data was gathered. Could they contact you the next round when there's another funding opportunity to contact you directly? Because I think some of this data would have helped in writing that grant.
Yes, absolutely. We do that all the time for people.
Okay.
If there are grant questions, data questions that you can't answer, a lot of the time we can just point you to exactly where it is and save you the time of having to dig for it yourself.
Would it be you, Sarah, or Katie?
You can reach out to me. Yeah. And then we have a research team of a couple people here, and one of us would be happy to help you, but you can reach out to me at the email address there.
Okay, thank you.
Yeah, you're welcome.
And Sarah, in the chat, it was mentioned that we're hearing a lot about increased disciplinary actions at school. And I'm not sure how you would get that information, but it would be useful to have.
Yeah, and I guess I saw that pop up too, and I wondered if Lynn, if you had anything else that you wanted to share about that, any additional context, because I know there's stuff that I've read about this topic, but would love to hear how you've seen it playing out, playing out there, if you're still on. Trying to look at this. She might not be on the call anymore, but
It looks like she dropped off.
Okay. We do.
Along the same lines that Gina was talking about with use and addiction of substances, I would be interested in knowing a little bit more about the use of electronic devices for smaller children, because that too is an addictive substance, especially for the youngest. And well, it's for all of us, but really impacts the brain development and the behavior. So behavior issues whenever adults try to take those devices away. And I also heard teachers talk about at the beginning of this school year how the increase of behaviors might be related to detoxing from how much time they've spent on technology. So I'm wondering, whenever we do those questionnaires, or I don't know how we would get that data. Maybe when kids enroll in childcare, or I don't know, but I'm just throwing that out there, that could also impact our discipline at school and behavior issues that are being reported, mental health issues that are being reported. So and the amount of time that parents are on those devices too, so that they're not being able to give the needed attention to the children. So anyway, so I wonder what the impact there is on our data.
That's a great question. I was just taking notes on all the topics you guys have brought up so far, because that's another area where I don't know what the research are saying, but you're absolutely right that probably all of us were on those devices a lot more when we were stuck at home over the last year and a half. And so it's undoubtedly going to have an impact on young kiddos where their brains are still developing. So I wrote that down as another thing to look into as we think about next year's report. And then on the topic of sort of behavioral problems and increase in disciplinary actions, I know I read a story in Education Week recently about the trauma that kids are coming to school with after the past year and a half, and they haven't been in-person school, and it is a huge adjustment for them to go from being home 24 hours a day to being in a classroom with 25 other kids and expected to sit and focus for that entire time. And the article talked a lot about, like, again, the importance of just sort of meeting kids where they are and not expecting them to just pick up where they left off and hit the ground running, but instead thinking about what resources can we provide schools and families, been through so much in the last year and a half, so that we're really recognizing and addressing that trauma that kids have been through. And I see another comment in the chat about staff professional development and turnover rates in centers and K-12 schools. Yes, I know my husband is a teacher and he has seen a ton of turnover at his school. My kiddo's childcare center has seen a ton of turnover. So I know just firsthand that that's something that a lot of places are struggling with and could absolutely have something to do with those behavioral challenges as well. And a lack of qualified staff. Yes. Yes, very complex issues. Great points in the chat. Other thoughts or questions? This has been really helpful for us to hear.
I was thinking about campaigns around getting people back together, doing human things again.
Yeah.
What impact that would be, but I know for when getting those kids back together and in the classrooms, I definitely suggested that, don't jump into the academics, that children need to play and they need to learn how to play together and spend more time on those social emotional, that social emotional learning, and getting kids back to learning how to be with each other and be with themselves. So
Absolutely. Yeah, we just did a presentation last week to the Denver Early Childhood Council, and that social emotional piece came up many times there, as well as being something that's going to be so critical to focus on, given the lack of interaction that kids have had over the last year and a half. Well, if there aren't other thoughts or questions, I will turn it back over to Vanjie, but just wanted to say thank you all so much. I know virtual data presentations are hard and they can be a slog. So we appreciate you sticking through it, and hope that there was something that will be useful to you in your work in here. And I know that we got a lot out of this presentation from hearing from you. So hope that you will reach out in the future if questions come up. And yeah, thank you, but I'll turn it back